It's really important that when you start to notice hair thinning or hair loss, that you come in for a consultation. The sooner you come in, the sooner we can develop a treatment plan. It doesn't always have to be surgery. It may be able to be stopped with just medications or topical therapy or even laser therapy. But if surgery is the answer, the sooner you start, the better off we're going to be. Well, in LA, we have sun exposure all the time. We can start wearing a hat at day 4, so that helps a lot. You want to make sure that you understand you just don't want to get burnt, because after you've done a procedure, if you get exposure to the sun, you can get post-inflammatory hyperpigmentation or increased pigment color in the skin that lasts longer. It really isn't that bad. We do local anesthetic, we give you Valium, we even have Pronox, which is like laughing gas, to make the anesthesia part easier. And it's really only the anesthesia, like what you get when you're going to the dentist, that is uncomfortable. The post-op is very tolerable and patients do extremely well with it. With today's technology and techniques, the recovery from a hair transplant is really pretty easy. Most people are back to work within a week. While it's not absolutely necessary to start prevention prior to a hair transplant, it's important that it's done in conjunction, because hair transplant surgery puts hair where it's not, but it doesn't stop the native hair from thinning or falling out in the future. Yes, it is. The hair transplant is permanent. That's why it's important that it's done right the first time.